Malaria is one of those illnesses people think they already understand. Fever chills. Treatment done. But when it actually starts, it rarely announces itself that clearly. It usually begins quietly, almost ordinary. Here are the common signs and symptoms, the way they tend to show up in real life. 1. Fever that comes and goes. This is often the first sign. The fever may rise suddenly, then settle, then return hours or days later. Some people describe it as waves. You feel okay for a moment, then suddenly very unwell. The pattern can feel strange, almost unpredictable. Chills and excessive sweating. You might feel intensely cold even in warm weather, shivering under blankets. Then, later, you're drenched in sweat like your body is trying to reset itself. This cycle is classic for malaria and happens as the parasites move through the bloodstream. 3. Headache and body aches. The headache can be heavy and persistent, not sharp, but exhausting. Muscles and joints ache, similar to severe flu. Some people say their whole body just feels sore and weak, like carrying extra weight. 4. Extreme tiredness and weakness. This isn't normal fatigue. Even sitting up can feel like effort. Malaria destroys red blood cells, so oxygen delivery drops, and the body slows down in response. You may feel drained very early in the illness. Nausea, vomiting, or loss of appetite. Food suddenly becomes unappealing. Some people vomit, others just feel constantly nauseous. In children especially, this can show up as refusal to eat or drink. 6. Anemia and pale skin. As malaria progresses, red blood cells are lost. Skin may look pale, lips lose color, and dizziness can occur. This is more noticeable in repeated or untreated infections. 7. Confusion or altered consciousness, severe malaria. In serious cases, especially with Plasmodium falciparum, malaria can affect the brain. Confusion, seizures, drowsiness, or loss of consciousness are danger signs and require urgent medical attention. A quiet but important reminder. Malaria symptoms can look like flu or a viral illness at first. That's why it's often underestimated. If someone has fever after being in or living in a malaria-endemic area, testing matters quickly.